Donna. How are you?
I'm doing quite well. How are you?
Great, thank you. It's a pleasure. I am so honored to have you on Mind Bloom. You are a fellow LCIS. We have different stories, I'm sure, because no LCIS is the same and no other history with surrounding breast cancer is the same. So I'm sure we'll have a lot to talk about. So Donna, we met virtually on Facebook, on a Facebook group called very explicitly LCIS. I believe that's the name. And I'm gonna leave it to you to explain or define or just break down the acronym for LCIS. But regardless, we met there, and we met specifically when you posted that you had started a blog or a page where you wanted to express and give an opportunity for your words to come out and your testimony to come out in terms of this condition, I guess.
Yeah,
I don't even know exactly how to define it. So, do you want to start with LCIS and
sure.
that?
LCIS stands for lobular carcinoma in situ. And it is such a scary diagnosis when your doctor calls and says, let's have a chat. You have something. And certainly, uh, lots of people who hear the word carcinoma think immediately cancer.
Mm.
And what you learn pretty quickly when you start trying to get more information about LCIS is that, in fact, you do not have invasive cancer.
Mm.
It is a neoplasia. It is an area of abnormal cells inside the lobules of your breast. And I should say, you don't feel it. You don't see it on a mammogram. You don't know it's there. Most every woman, I think almost every case, has been diagnosed via biopsy.
Mm-hmm.
So I happened to have a biopsy of tissue, and it came back with a diagnosis of LCIS. And I went searching for information. And as it turns out, even a lot of doctors aren't very aware of what LCIS is because it's really quite rare. It is a risk factor for developing invasive breast cancer. All of the paperwork says within 10 to 12 years of your initial diagnosis. So you have some time to make a decision after you find out what it is. It's just that it's hard to get very good information.
Yeah.
Your doctors, unless they're very specified, don't know what it is. They'll call it cancer, but you really don't have cancer. And so, like you, perhaps, I went online searching for resources, and I did find a Facebook group, an LCIS support group, which I was so happy to run across. And there are so many other women like you and me who kind of struggle with, what is this? How concerned do I need to be about it? What kind of treatment is the best to take for it, or what options to choose for it? And I just felt like I wanted to change the name of LCIS.
That's right.
Because when you hear lobular carcinoma, it hardly sounds like it's not cancer. It is not cancer. One of the breast surgeons specialists that I went to along my journey told me they really need to change the name to lobular neoplasia, which I'm in full support of. I think it would cause us a lot less angst.
Exactly. It is the
Yeah.
angst that kills us ultimately. You're left with a diagnosis of this acronym, and you come home and you start reading, and you definitely don't have a clear vision. My breast surgeon, after in the post-op appointment, dismisses it, and calls it, it's not cancer. You're okay. It's not cancer, and the margins were fine. Everything was okay. So go home and I'll see you in 6 months. Regardless, you have to see an oncologist, and you probably need to take tamoxifen. And I just want to add that a double mastectomy is your choice.
Right. Yes.
So I come home.
Yeah.
Okay, it's not breast cancer, but what do I make of all of this, right?
Right. And the treatment
And
options include everything from doing nothing to removing your breasts.
uh-huh,
Quite a
uh-huh.
span.
Quite a span. So not being cancer does not really help. I understand that calling it something that is so removing the carcinoma name from the acronym makes complete sense.
Mhm.
And you do need more explanation regardless. Just calling it hyperplasia, neoplasia, that's
Yes.
fine. But the woman needs to leave the doctor's office with some answers. My OBGYN, and like you were saying, calls it cancer.
Mhm.
My breast surgeon does not call it cancer. It's like, make up your minds, ladies.
Yes, yes. My plastic surgeon to this day, and I love him. I love him. I ended up in my journey, I had a preventive mastectomy,
Yeah,
and he still calls, refers to my cancer. And
yeah,
I don't try to correct him
yeah,
anymore. It's really sort of pointless at this point. I don't
yeah,
have it anymore. I
yeah.
removed it from my life, but that was just my decision. There's so many other decisions that you can make along that spectrum.
Mm. And I want to talk more about that, so hold your thought. I do want to step back a little bit and talk about what you were saying about it not being visible, and I completely agree, and I experienced it in firsthand. It's not visible in mammograms. Even lobular invasive cancer is very, very hard and tricky to find, but ours definitely is not seen in mammograms, very difficultly in ultrasounds, and mine, and you'll tell me more, mine was found in an MRI, just a fluke.
Wow.
My doctor decided it was time to have an MRI. I had done a couple before because I've always had very complicated breast tissue. So she thought last year she thought it was time to do it again, and they found this 7 millimeter mass, and then the biopsy, and then the lumpectomy, etc., etc. So how did this go for you?
Well, it started, I'm going to say it was 2 years ago. I went in for plastic surgery to have a breast lift and reduction,
Mm.
and a vain thing to do, I suppose. It's something that I
No, no,
needed to
no.
do and wanted to do for my
Of
life,
course.
having no um, indication that I may come out of it with a diagnosis. I have no
Wow.
family history of breast cancer. And so after the surgery, I received notice from my physician that he wanted to talk to me. They take tissue. When they remove tissue, they just, as a normal course of action, send it for lab results or
That's
lab
good,
testing.
though. That's
And
very good.
so I got the report back. There was this focus of LCIS, and that started my journey. I uh, naturally, you go to a specialist and you talk to them, and then you want to research your options. And like you said, there's not that much information out there, and not a lot of your local physicians will know about it. You really need to seek out professionals. Not a lot of people have seen it or treated it. So it's just pardon the noise here. It's just LCIS is a scary sounding thing, and it presents itself differently in you and in me. Um, what was interesting for me is that because it was found in removed tissue, I had no idea if it
Oh,
if there were still any left in me,
that's right.
So, like you said, we all, I guess, have a unique path that we travel. Ultimately, I think from the beginning, I had this thought in my mind that whatever that was in there, I didn't want it to stay in there.
Mm-hmm, mm-hmm.
So I always thought I would treat it very aggressively. Cancer is something that I have seen up close and personal with family members and friends. And it's just a very frightening thought to me. Much more frightening than LCIS. So I wanted to lower my risks as dramatically as I could.
Absolutely.
Yeah.
So you had just come out of surgery. You're
No, it was about a week later.
a week later,
Yeah, at my
and
next appointment.
now so it's interesting. You never had the biopsy and all of that. It was because the tissue was removed in the first place,
Yes,
and then you had surgery again, a double mastectomy.
I did. I took about a
How much longer?
year.
Okay.
I took about a year's worth of time to, like you, every 6 months I would go. I would have an exam, have an MRI, a mammography, a breast exam,
Right.
and I did try one of the medications that lowers your body's reaction to estrogen.
Right.
I didn't like it at all. The
Tamoxifen?
medication, I didn't try tamoxifen. I actually tried the anastrozole. And it's actually less strong than the tamoxifen, and I didn't like it at all. So I was able to say, I don't think I want to do 5 years of a medication that makes me uncomfortable for only a 50% reduction in your increased risk.
Yeah, exactly.
It doesn't completely reduce your risk, it just reduces it about half.
Yeah.
And so after lots of consultation with physicians, with my family, I just decided to go the preventive mastectomy route.
Yeah.
And the last time I saw my breast surgeon, he told me my risk for developing cancer now would be between 1% and 5%.
That's great.
I can deal with those odds.
Right, that's a great risk.